That's why they spelt out VET instead of saying it. Clever. Oh well, I always get treats when I'm here anyway. Oh, hello.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Here she is, the puppy with the best haircut in town.
Just make sure you're not swollen under there.
Known as a nation of animal lovers, the UK is home to 36 million household pets, 12.5 million cats, 13.5 million dogs, and not to mention all the other creatures, great and small, that we welcome into our families.
And in this brand new series, we'll be finding out what happens when our fur-legged friends are in need.
I'll meet their devoted owners and the expert staff who treat them. From the routine...
Emergency Ward 10, I'm your girl.
...to the life-saving and everything else in between.
I could sit here all day and talk to these doggies.
We'll capture the intense bond between owners...
Hello, darling. Hello, sweetheart.
...animals and the vets.
Good girl.
And we'll also see some of the special skills man's best friend deploy in a life-or-death situation.
A search and rescue dog is trained to locate live casualties.
Good girl.
So, join me, Fern Britton, on a roller coaster of emotions inside the vets.
Just north of the city of Bristol is the residential suburb of Henleaze, a tangled maze of pretty Edwardian streets. It's here that husband and wife team Andy and Amy Valencia set up their veterinary clinic 5 years ago, after entering the world of vet medicine 17 years ago. Together, they run this independent practice in the heart of the community, for the community.
Oh, look at you.
Dr James Greenwood also practices with Andy and Amy. Their friendship was forged in their uni days, their veterinary paths crossing over the last decade. Together, they have graciously extended an invitation for me to join them and their dedicated veterinary nursing team to see firsthand what it's like to be inside the vets.
They are so cute.
For most pet owners, the vets is almost like their fourth emergency service. Nearly 3/4 of owners believe their pet's health is as important as their own, which is why on a cold spring Bristol morning, these pet parents have brought their animals in for a range of treatments.
Have you got Henrik with you?
I do indeed.
Have it. Do you want to pop on in with me to the room?
Sure.
And first to see our vets is newbie cat dad, Josh, with his moggy Henrik.
How's Henrik been?
He's pretty good.
Vet nurse Ella is admitting Henrik in for a castration.
And he's having a microchip too
Yes,
today.
please.
Perfect.
Yeah, you are.
Lovely. Surgery-wise, shouldn't take too long. It's probably maybe like a 10-minute procedure.
So I guess pick him up in the afternoon.
Yeah, and we'll give you a call as soon as he's done, just to let you know how it's all gone.
Cool. Good. See you soon.
While Henrik is taken through to the nurses for his pre-op checkup, I catch up with his owner, Josh.
So you've just brought Henrik in. Tell me how you met him.
So he's a new addition. I used to live in London, and I've got a very trusted mechanic who looks after my old vintage Land Rover.
Yeah.
His name's Henrik, and we were sitting talking, and from underneath my Land Rover comes this little meowing. So I pop my head under, and this little black cat appears. So we took him to the vet, and the vet gave him a once-over, said he's a really healthy cat, and that we can either send him to the RSPCA or take him home.
So he had no chip.
He had no chip, no collar.
So you said?
So I said, I'll take him, and his namesake, after the marvellous mechanic Henrik. So we call him Little Hen, which is very cute because he's very small and tiny and petite. So I think it suits him, but to have such a formal name, I think is actually quite,
Yes,
it's
correct.
quite fun. And when he's naughty, he gets called Henrik. But the rest of the time, it's Hen.
How long have you had him?
So had him, it was just after New Year's, so about a month now.
Well, I'm going to be Not exactly assisting, but certainly watching.
Look after him.
And I will. I'll hold his paws while he's asleep.
Brilliant.
Don't worry. He's going to be fine.
Excellent.
You better go and get yourself a cup of tea and have a rest up, because I know it's a nerve-wracking time.
I think so.
Just listen to your heart, okay?
Once his vitals are checked, it's over to James to start the pre-meds. And as cats can be quite nervous, through trial and error, they've engineered a simple way to keep Henrik calm.
I can feel his tail wagging
He's
against
lashing.
me, which is normally a sign that he's feeling a little bit nervous as well. There, you're okay. Right, let's see if we wrap him up in this big towel. Okay. Yeah, if you're quick. Quick.
I'm so gonna...
Okay?
Done? Well done.
Oh my goodness.
All done.
What was that?
Done. What was that?
Gonna start
Nothing to
feel a little
worry
better
about.
now. Well, the towel wrapping him up, but is that something that you have found helps, or is it something you're taught as a vet?
It's a bit of a combination, really, isn't it? The thing is, when animals come to the vets, there's that combination of wanting to keep them as calm as possible, but we do have a job to do, and we all need to stay safe as well. And cats have 5 big weapons, their mouth and 4 very sharp feet.
Yeah.
So it's a combination of a recognised way to safely handle them so that we can get the job done, but without causing them too much stress in the meantime as well. And we've sprayed the towels with a special pheromone spray as well, which helps to just hopefully keep them calm as well.
Good scent.
Now, Henrik, this is your chance to have a nice sleepy snooze, eh? Should we take you back to your bed? Okay.
Once Henrik is sedated, he's moved into surgery, so James can get on with the job at hand.
Right, let's start.
Well, you're at the business end.
Absolutely, yeah.
Okay, can I hold his little paw? Because
Yeah,
I
of
did
course you
promise
can.
Josh.
Oh, yes,
There we
of course
go.
you can. No
So I know
worries.
this is sterile, but not.
Yeah, so we would class this as being a semi-sterile operation. So because we're not necessarily going into any body cavity, so it's not quite the same as maybe doing like a spay or maybe like an orthopaedic operation. There is a slightly lower risk of infection. So we still like to put gloves on.
But you don't need a mask.
We don't necessarily need a mask or a hat, you know.
Can I just see what you're doing
Yeah,
there?
of course you can.
Perhaps I don't want to. Poor lad. But this will make him quite happier, won't it?
Yeah, there's all sorts of benefits to castrating male cats. I mean, you know, a female cat can have up to 3 litters in a year. And obviously most of us in the UK do let our cats out rather than having them as indoor cats. So one tomcat can potentially father a heck of a lot of kittens if we're not careful. So, yeah, so there's a bit of a dual responsibility, I think, on both male and female cats to have them neutered.
I agree. All mine have been neutered, yes.
And the other thing we need to do is microchip him today.
Yes.
Yeah. Microchipping is now a legal requirement for cats.
Brilliant.
So often when they are asleep, we'll then put the microchip in when they're either being spayed or castrated, whether that's a female or a male cat. So it's a good opportunity for us to get a microchip into him as well.
Yeah, that's a very good thing. There he is. So you're going to chip him now?
Yes, yeah. So I guess firstly you just want to make sure that he doesn't have one, because
oh yes,
I know they've checked, because
It
there
has
have been
been checked,
instances
double
when
check.
you're about to microchip them and they actually already have one. Cool. It says no chip.
A microchip is a tiny, rice-sized device containing a unique identification number linked to the cat's owner, which can help reunite lost or stolen cats with their families. It's inserted under the skin using a needle, and the procedure is quick and painless.
Right.
I'll just start
Mission
wake him up.
accomplished.
Mission accomplished. That's us all done.
Next up is 10-year-old Cavachon, Miley, whose bouncy gait and waggy tail is masking a very painful disease.
Good morning.
Hiya.
Hiya.
This is Miley.
Miley. Perfect. If I mark you in, do you guys want to grab a seat and we'll see you shortly?
Thank you.
Miley is a beautiful dog. She's gentle and good-natured and calm, and she's part of our family. And we're very fond of her, and we want the best for her. About a year ago, she developed a limp that didn't go away, so we took her to see Andy, and he assessed her and told her that there may be problems with the cruciate ligament and the kneecap. And it did go away, but then it recurred, and that's when we thought we need to take some more steps. She was pretty uncomfortable, and I mean, she's got 4 legs, but one of them was out of commission. She was holding it up, and she couldn't run. You could tell she was in a lot of discomfort, so we had to do something.
Miley was still trying to run when her leg was impaired, and what would happen was she would go on a walk and chase squirrels and then come home, lie down and then struggle to walk afterwards. I didn't like to see her in pain after the walks. It was worrying.
Hello, Elaine.
Hello.
Hi, Fern. Very nice to meet you guys.
Hello.
Hello. And this must be Miley.
Yes.
Miley. Hello, pretty girl. How are you? Oh, she's wagging her tail.
This is Miley's final consultation before her owners commit to the next phase of her treatment.
So it's a tricky, difficult time for you today.
It is. It is.
Yeah.
We are a bit worried and a bit nervous.
What will it mean to her when this will be successful, when she'll come through?
Yeah.
So, you know, what will it mean to all of you?
Well, it's peace of mind, really. We put a lot of love into this dog, and we enjoy her company, and we want it to continue for as long as possible.
Yes, and she's putting a lot of her love into you too.
Yeah,
really. She gives us a lot.
Really, she gives back.
Yeah.
But she loves running, especially in the woods, and it would be awful if she couldn't do that anymore.
It's a big operation.
Yeah.
And, I mean, it's the one that footballers have as well, isn't it? The cruciate ligament.
Yeah.
Right, yeah.
But more than that, my grandson had it.
Oh.
He's a Chihuahua. And my daughter, I asked her this morning, because I knew that we were meeting you, and I said, could you just ask, he's called Hulk, could you ask Hulk if he has any tips for you for recovery? And what he said is, he says, recovery is tough, but it's all worth it in the end.
Oh.
And not to worry too much if you struggle to bend your knees when you're weeing at the beginning. You will get that back, he said. And then he also says, snuffle, snuffle, snort, snort. Okay? I think she's...
This is good.
I think it's going to be okay. We're going to make sure you're okay. All right, darling?
Uh-oh. Vet bills? Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
All 3 of our vets have skills that complement each other. As well as all qualifying in general veterinary medicine and the broad range of expertise this gives them, they each have undertaken extra training in different areas. In Andy's case, his interest means he now holds the European Surgical Certificate. Amy has taken a keen interest in internal medicine and ultrasonography, and James in dentistry and dermatology. Together, there's pretty much no area of veterinary medicine they cannot work in.
So, James, this is the dentistry you're going to do now.
Absolutely. Welcome to the dental suite. Yeah,
you can do everything.
So we've got little Betty, who's coming for
hello,
here she is.
Betty.
Coming for a scale and polish today. You'll see in a second, she's got quite a bit of tartar and plaque building up on her teeth.
She's very relaxed.
She's had her pre-med, so she's already in the zone for her anaesthetic.
Yes.
So first things first, should we get the cannula into her leg, and then we can have a good look what's going on in her mouth. Let's have a look. Good girl.
It may seem unnecessary, but putting the animal under means that James can do his job quickly and efficiently without causing more stress to the patient.
It's so wonderful to see an animal relaxed and know that this is a normal, normal in terms of medical state. Nothing distressing for us or for her.
Yeah, And it allows us to do our job. And then what we'll do throughout the anaesthetic is Ella will be periodically checking things like heart rate, temperature, respiratory rate, making sure that everything is nice and stable so that I can do what I need to do at my end.
So this is keeping her eyes, what?
Just lubricated, and so they don't dry out.
Nice.
Yeah.
Eye drops. All this, darling, because you didn't clean your teeth.
Okay?
Okay, let's do it.
Here we go. So the water helps to keep the tooth clean. What we do is just go over each tooth individually.
Yeah. I can see this would be very difficult to do if she was awake.
Yeah, I mean, they just hate it. And you just can't do a thorough job, you know.
Look at that. That's coming up so beautifully.
So satisfying, isn't it? What we've got there, that blood is basically gingivitis. So we've got the plaque on the tooth, and then that's caused a mild gum infection, basically. But that is reversible. So whilst it's bleeding now, if we then follow this up with regular toothbrushing, that over time will settle right down.
Good.
So there is hope still, even though it's quite bloody now. It's still worth carrying on with.
I'm beginning to understand why vet bills can seem so big because of all of this that you're giving them.
I think it's something that is quite easy to look at the bill and just see the figure. But actually, you know, we've got all this advanced equipment, we've got the building we're in, you know, Ella's trained as a fully qualified vet nurse, keeping Betty safe. You know, I'm a vet, I've been through long training to get here. So there are hidden costs that maybe people don't necessarily kind of appreciate when you just see that figure. But it is one reason that we do look at insurance, and especially maybe with dentistry, where not all policies would cover dentistry, but if you are looking, finding something that covers dental illness as well as injury is something that's worth having on your radar.
That's very interesting. You should be smiling now, should be showing off.
Absolutely. Hollywood smile. So this is just the finishing touches.
Yeah. Is it minty flavoured?
It is actually.
Is it really?
Yeah. Minty fresh.
While James is busy perfecting Betty's Hollywood smile, Andy is in the consultation room
This way, good girl.
to review the options for Miley's leg.
Cool. Yeah, if we close the door, that'd be fantastic. We've been discussing about that whole idea of just because you can do something doesn't mean that you should. And there's a reality now that with time, the acute phase of inflammation has gone down.
Yeah.
She's a tough dog, eh?
Yeah.
Because for a dog that's got both a blown cruciate ligament and her kneecap's also popping all over the place, she's walking quite well.
Right.
The hope is that both of Miley's issues can be remedied in the one surgery, but some of the options for correction may require specialist attention.
When she was limping and not walking very well, she was in pain.
Yeah.
And she wasn't the happy dog
No.
she is today.
Yeah.
So we don't want to return.
This is a big procedure.
Yeah.
Yeah, and we need to know that we're going into this knowing that, you know, we've already had a discussion of potential risks, right?
Yeah. We feel like you've given us a lot of information.
Yeah.
Yeah.
And we've got experience as you caring for our dog.
Yeah.
Yeah.
We think you're doing the best thing for her.
Yeah.
And so we'll proceed.
We've discussed it in depth.
Now that they've confirmed they'd like Andy to do the procedure here at the Grove, his plan is to place a nylon ligament to stabilise the knee and to deepen the groove and correct the alignment of Miley's kneecap.
I think this is the right plan.
Good.
All right. So as long as we're all on board, now that you've made a decision, I feel confident saying that if I was in your shoes, this is the way I'd be going with things.
Hendrik's looking good.
He's looking great. He's already eaten. He's had a dish of food. He does have a cone of shame on to stop him licking, but yeah, he's come around really well.
So now can we ring Josh?
Yeah, let's do it. Let's see if I put it on speakerphone. So, okay, there you go.
Quite exciting, isn't it? They'll be waiting for this call. They'll be nervous too.
Hello?
Hello, is that Josh?
It is, yeah.
Josh, it's Fern, and I have good news about Henrik.
Excellent. Everything go okay?
Everything went well. He was a model patient. Everything's been done.
and apparently he's had some food, and I've just had a look at him, and he's relaxed and happy. He's okay. And if you want to know any more, I'm going to pass you to James, who, of course, is the expert. I just wanted to speak to you. And I held his paw, and he was a very, very good boy.
Oh, I'm so pleased. Thank you so much for looking after it.
My pleasure.
Hi, Josh.
Hi, how you doing?
Hi, good, thank you. Yeah, he's done really well. His recovery's been smooth, his anaesthetic all went fine, surgery's all good, so yeah, we're really happy he can come home.
Perfect, excellent.
Bye, Josh. Bye.
Bye, Fern.
That's one of the best parts of the job,
Isn't it?
You know, that
And to hear-
moment.
Oh,
Yeah, the relief is
yeah.
great.
Good. Well done.
Yeah, great. What a team.
What a Still to come, these adorable pups pay an important visit. And we step outside the vets to see how man's best friend can save lives.
Our search and rescue dogs can locate casualties in a fraction of the time that it would take a whole team of people to find them.
Ah, stung by a bee. Don't judge me. It'll probably happen again.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
This particular surgery is family run. What's so wonderful is it is in a residential area on the corner of a little road. I suspect that people go, yeah, when you go past the vets, that's where you and I'm just opposite every day. And it has the people that I've only met this morning just coming in, really part of the community. And it's like a hub here, isn't it? So it's mostly cats and dogs and domestic animals here?
Yes, very much so. So I'd say dogs and cats predominantly. Maybe that's because of, again, where we are.
So no surprises coming through the door too often?
Of course, there's the bread and butter stuff, so the vaccinations, the stuff that you'd expect on a day-to-day basis. But the thing about being a vet, especially here in the heart of the community, is that anything can happen. So we might get pets that have eaten something they shouldn't have. We might have to do a sudden emergency surgery for any reason. Cats and dogs obviously get hit by cars, unfortunately. So sometimes we'll have something literally rush through the door. And so, you know, what feels at the moment like a general practice, almost like going to a GP surgery, can very quickly sort of suddenly turn into an emergency room where everybody's hands on deck. You know, there's a patient on the table, all the emergency drugs are out, and we're trying to quite literally save lives there and then. And of course, sometimes it's really upsetting when we can't make things better or things don't go the way you hope. But then there's also those moments where you do get them through and you sort of think, well, without the veterinary team, and it is a team, it's not individuals. You know, I can't do my job without the nurses, without the team out the front. You know, it relies on everybody coming together. And it sounds cheesy, but I do think it's the best job in the world.
But it's not just the patient you're dealing with, it's absolutely terrified owners who are upset and worried, and that's a whole other skill.
You see people at the most vulnerable because our pets do mean so much to us. And when something doesn't go right, it can shatter people's worlds. And I've been there with my own pets, you know, where you've lost a dog and it turns your world upside down. There is a weight that I suppose you carry yourself, even though it's other people's pets. It's quite hard to just leave that at work and go home. You go home and think about it, you mull over it, and you empathise for those people that day has just completely changed because you've delivered something, something potentially quite upsetting.
The most common time to visit the vets is for routine appointments, especially in the early years of an animal's life.
Here we go. Oh, look! Oh, look at you two.
So meet the two 8-week-old lab cocker spaniel mixed puppies who are due their first vaccinations.
How's your last 48 hours been? Has it been utter chaos? Has it been sort of a dream? How are you getting on?
Chaos.
Has it? Yeah. Okay.
They've definitely woken up and found their voices and their feet and everything else.
Should we pass them up? Because I don't really want them to
Yeah.
go on the floor necessarily right now before the vaccination. So shall I grab... I tell you what, if I hold one and then...
You gone for the calmer one.
Thank you.
It's recommended to avoid taking puppies outside in public places or for walks until they've completed their vaccination course and are fully protected.
Looking very, very cuddly and cute. Great. OK, so no vomiting or diarrhea like we spoke about. You're happy that they're eating well, drinking normally? Yeah,
They're
good
eating
appetite.
really well.
Great.
Yeah.
Everything coming out the back end as normal.
Yeah,
What goes in must come out.
Definitely.
Good.
Plenty of that.
So that means we can get on with their vaccinations today. We'll then do another one in 2 weeks' time, and then another one 2 weeks after that. Oh, names. Have you got names?
We have.
Yeah.
Oh, come on. What have you got?
So you've got Marley.
Marley.
So that's after Jacob Marley because they were born at Christmas.
Oh,
hopefully we couldn't go for Scrooge or anything like that.
Marley.
Marley.
Very cute. And then
This is Mono.
Mono.
Monochrome.
Oh, nice. Oh, Mono and Marley. Good.
James needs to do a full once-over of each dog, making sure they're in good health in order to be vaccinated. He also updates the surgery records of each dog with their new name, corresponding to their unique microchip number.
Right, let me change Marley's records on here. Hello. Marley. Yeah?
Yep.
Great. How did you get on with insurance? You were thinking about insurance, weren't you? Did you
Yes,
make a
we are
decision?
going to. Yes, we've had some quotes.
Okay.
So just looking at
Who were you looking at?
pet plan.
Okay.
So yeah, I just need to do the final thing.
When you've made those decisions, just let us know,
Yeah.
and then we can add all of that onto your record
Brilliant.
as well.
Thank you.
Okie dokes, right. So let's look at doing the vaccination. So I'm going to probably need a pair of hands. I wonder if I could just give mine to you. Either which way works.
Yeah, that's fine. There we go.
Okay, so what we're going to do, because this is their first injection, I just want to make sure that they have a nice positive experience. So I'm going to lace up a puzzle mat with
they
some
are
treats.
very hungry because we didn't feed them and they're due a feed at 5 o'clock. So,
Oh, right. Oh,
yeah,
this is hopefully going to work in my favour.
yeah, they are very hungry.
PSA. Worming and flea treatments are tailored to individual risk and will vary depending on your local area. As Marley and Mono are in a fairly residential one, they will have monthly flea, tick, mite, lungworm and roundworm treatment, and tapeworm every 6.
Right. Should we start with Marley then? Now then, Marley, look what I've got you here. Should I put this over here for you? Yeah, this is exciting, isn't it? So hopefully with a little bit of distraction, you won't notice what's happening back here. There we go. There. Perfect. Hardly noticed. That's how we like it.
Absolutely.
Great. Right. Should we have a little look at Mono then? Hello, Mono. Hey. Are you happy to just have a little hold of his shoulders like this so that he just doesn't move? There. All done. 2 little brave boys. Very good.
And the final step in their puppy checkup is to record each one's accurate weight for their records.
So he was 4.89, he's now 5.18. in just a couple of days.
Right, okay.
They're obviously settling in well. That's what I'm going to say. I'm happy, this is good. Let's have a go with Marley as well.
Okay, go on then.
They are both just over 5 kilos, which is good to have done because they're slightly different on their weight bracket from where they were on Friday for the flea and worming stuff.
These appointments not only give your pets an opportunity to get used to going to the vets, they are also vital in order to avoid preventable diseases in your pups.
Great. Okay, thank you very much.
Beautiful.
Great.
And just remember, you can bring them back and see me anytime you want. Anytime you like.
Thank you very much.
Okay, no worries. I'll grab the door. Okay, all right, we'll see you soon. Bye, bye.
Hi Sarah, it's Amy calling from the vet.
There's a good chance we're going to have to cut this bone from this point to this point and shift it across.
Prior to Miley's procedure, Andy studies her X-ray to help plan for any eventuality once he's in surgery.
The thing is, it's fine seeing it on an x-ray, but when you actually get in there, it doesn't look exactly the same as this.
So the theatre is prepped, she's been given her pre-meds. Andy and the team start to ready for surgery.
So Miley's out now, she's under anaesthetic, getting prepared to go into surgery. And you can't help but see her looking vulnerable. But she's in good shape, she's going to be all right. God, I don't know why. That's so silly, isn't it? But she's, yeah, special.
It's hard when you see them under anaesthetic.
It is, it's just that...
They are so vulnerable.
Yeah.
Do you know what I mean?
But she looks good, she looks good.
She's very stable at the moment. Absolutely fine and stable. Pulses are good.
The potential problems that you could have with this operation are what?
In the worst case scenario, catastrophic. Whenever you are cutting bits of bone and pinning them in and pinning them back and everything else, there is a chance that you could, if things don't go well, you could cause more problems than you've gone in to fix. But anyway, fingers crossed, everything's going to go the way we want it to.
Yes, and Miley's healthy, fit. Apart from this, she's in good form.
She's in good form. She's also a tough old cookie. You were looking at her, she's a little floofy thing, but she's hard as nails. And so I think hopefully she's going to rebound, get through this, and it's going to be, you know, we're going to be very, very happy when she comes through this recovery period, which is a much more comfortable, happy dog.
For this potentially complicated procedure, Andy will be leading the surgery, assisted by James, vet nurses Alice and Leah.
Beautifully done.
Thank you.
And B.
When you're ready, I'll do under your toes. Mission accomplished.
As infection is any surgery's nemesis, after Miley's been transferred to surgery,
there we are.
The team gets scrubbed in.
Because Miley's now in a sterile environment, I won't be touching anything, so I don't need to get scrubbed up, but I do need to cover face and hair with my little unicorn hat. Emergency ward 10, I'm your girl.
We expect to wait most of the day, and we, in a way, hope to wait most of the day because we hope he takes his time.
Yeah. We'll be anxious to hear. He said he'd keep us informed of what's going on.
But there is risk. He's explained that there's risk.
Yeah. We'll be worried all day long till we actually see her and take her home. And we hope that's how it goes.
We're going to be making a decision on the size of the knee joint, the staphylid joint here. But the first thing I'm doing is I'm just trying to check the alignment now we have her completely asleep. So looking at where her quadricep muscles are. So it is ever so slightly out of alignment. It's really minimal.
But if you do what you're hoping to do, the longevity of that treatment will last all her life?
It should do, yeah. So if everyone's ready?
Yep.
Nurses, are you ready for me to cut?
Ready.
Right. Won't need any more than that. We can always extend it if needs be.
Wow.
I'm in two minds as to whether or not we're going to need to move this across.
So at this point then, I'm going to leave you to concentrate because you don't need me hanging about. And to be honest, I think I need a cup of tea.
Yeah, I think so.
Miley, you're in very good hands, and I'm very glad that you are. And this is not as awful as you thought it could be.
What we've got is, we've got very, very good chance that we should be able to correct this.
Brilliant.
All right?
Miley, see you on the other side. Good luck. Bye. Got a lot of heavy-duty toolage going on there.
So far, so good, and we'll keep cracking on, and we'll see where we get to.
It's looking nice.
Dear Miley, she's doing really well. And the vets aren't doing too badly either. Miley's blissfully unaware. I hope she's dreaming of running through the fields with her knee not hurting anymore. Blooming brilliant, aren't they?
The thing is, though, it's more important that we've got a a deeper groove proximally than distally.
Okay.
So I would say that's better, but we do need to find a way of making that
Just
sit
go
slightly
deeper
deeper.
again, yeah.
I reckon they've been in there for about 2 hours, maybe just over 2 hours.
Last stitch.
I think hats on, all done. Nice.
Done. Well done, Andy.
Let me get my mucky gloves off.
Congratulations.
Oh,
So how was that? How
Yeah.
did it go?
really well.
Yeah? Better than you hoped?
We had to do less to achieve the outcome. It was a more simple job just to correct and to stabilise the cruciate ligament. So yeah, it's all gone very, very well. Very, very happy with the outcome.
done.
Now, fingers crossed everything keeps going. This is only the first step. So the surgery's done. Now we're talking about all the rehabilitation and everything else, which and we've got very, very committed owners. So I know they're going to do everything I ask of them.
Often monikered as our most faithful friends, we may be more used to the special bond between dog and owner in a domestic setting. Yet it's this bond that's enabled different breeds to be fated in the world of canine work, be it as guide, therapy, or service dogs. Another vital job is search and rescue, where the dogs are trained to sniff out live casualties from any manner of perilous situations.
I'm just going to warm her up a little bit because she's cold out of the van, so I'm just going to take her over here just to have a little run around. Come on, can do wheelies then.
Rachel King is a firefighter based at Hicksgate Fire Station for Avon Fire and Rescue Service. As well as the day job of putting fires out, Rachel is also the station's dog handler.
I've got 2 working dogs. Sally is the first dog that I had, and she is 8 years old now. I got her when she was 1 year old. She is incredibly bold in those hazardous areas. She is not timid, she's not scared of loud noises. So that's some of the attributes that we need from the dogs. Good girl, she's found herself an apple there. And my second dog is Blue, who I got about 1.5 years ago from the dog's home, and she is Belgian Malinois. Good girl. Come here. Completely different training the 2 different dogs. She's got loads and loads of energy and just wants to work. Good girl. Come on then.
Rachel has been part of the urban search and rescue team for about 17 years. The teams have always had a requirement to have a search dog, so finding and training those dogs is now part of her remit.
Good girl. The important thing is that we work these dogs, we train these dogs, and we select the dogs as well. So it's really important that we get on with them and that they fit into our life and they get on with our families and our other dogs. I feel quite privileged to be able to work the dogs. It's fantastic. On a good day, it's the best job in the world. Why is there a search dog if you can hear me call out? Oi. A search and rescue dog is a dog that is trained to locate live casualties. So they will ignore any distractions, any deceased. That person might be completely concealed in a void. They might be buried underneath rubble, so completely unvisual. What we train them to pick up on is all the gases that come out of your lungs, all the products that we use to wash our clothes, wash ourselves. It all builds up a scent picture, and the dogs pick up on that. They find that strongest source of the scent, and then they bark, and it's all for a reward, all for a toy. Let's out. Good girl. Our search and rescue dogs are a really important tool in the box. They can locate casualties in a fraction of the time that it would take a whole team of people to find them. We always risk assess it to make sure that the dogs are going to be safe, but primarily they can go into areas that we can't.
In today's simulated exercise, both Blue and Sally take turns to sniff out casualties in situations that Rachel has previously experienced. This training is vital, as dogs are situational learners, and just like us humans, will suffer a skills fade. so they need to repeat their training in as many different environments as possible.
There'll be scent coming out all around this building. As you can imagine, a collapsed building, there's going to be gaps and holes everywhere. Go on then, up. Good girl. So she was picking up scent there, and that's why she was barking. But actually, for training, we definitely want them to get to that strongest source. So we want her to work out the best way of getting in. Good girl. Yay! What did you get? What did you get? Good girl. What a sound. Clever girl. Well done. It's important that when the search is over, that we take the harness off so she knows that the work's over and she's finished her job and she can have some chill out time.
Now that Sally has successfully completed her skills training, it's Blue's turn.
Fire service search dog, if you can hear me call out, we're fine. Blue, come. Good girl, here. Good girl, go on then, up. So she's getting a reward now, and lots and lots of value in that casualty there, because obviously I want her to basically walk over the rubble pile, work independently, and all for that casualty there. So, yeah, she's done good. Thanks, Graham. So we're going to search this building now over here. Good girl. Fire service search dog, if you can hear me call out. Good girl. Yay. Oh, brand new toy. It's got a squeaker in it. The squeak won't last for very long, unfortunately, so she's going to be particularly happy with this one. Good girl. Good girl.
Working in such hazardous conditions could mean the dogs may require veterinary attention.
It's really important, because the area is so hazardous, that we always give them a really good check afterwards, good welfare check. There's lots and lots of things on there that they could cut themselves on. So I'm going to take this off to make sure she knows that she's finished working. Good girl. Yeah, what did you get?
They do the job really, really quickly, and they work really, really well. It's quite black and white, really, to them. What they're doing is they're locating and indicating quickly, which is what we need to know to save lives.
Here we go. Brilliant. All fitting well.
It's estimated that dogs like Sally and Blue are used over 150 times a year in incredibly hazardous situations. In addition to being used in missing person searches, they really are our four-legged heroes.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britton Inside the Vets, brought to you by Pet Plan Insurance.
Hey, Miley, I've got good news for you. You know those humans you love? They're outside waiting for you. And they've been very worried about you. But you've been worried about them, have you? I see. Well done, you. You've done a good job. And look after that new knee. Yeah. Okay, good girl.
After Andy has given Miley's owners the post-op rundown, it's time for them to be reunited with their beloved girl.
Look at her go. Oh, good girl.
You
There she is.
All right, boss?
Look at her.